Hey guys, I don't know if you've heard, but Cabo Fest is almost sold out. You might be able to squeeze in and get some great ultrasound, great teaching, and great resuscitation education, as well as get to drink some cervezas and hang out with some cool people. But if you can't make it, either because you waited too long to register or because maybe you don't like to have fun, I don't know. I have some exciting news. Registration for CastleFest 2017 is open. Check it out. I've been going to CastleFest since the year after it started, and I can tell you it was amazing the first year, and it gets better and better every year. Just type in castlefest2017.com and prepare for adventure and education. Now, ready your eyeballs and ear holes because it's time for 5 Minute Sono. This is Jacob Avila of 5 Minute Sono, and today I'm at the University of Tennessee in Chattanooga, and I'm joined by a few of the faculty members. We have Ben Smith over here. We have Ben Grayboys, who's our new ultrasound fellow. Dwayne, intern. Quentin, other intern. And we have the one and only Jacob Hennings right here. And what we're going to do today is we're going to talk about a case. Now, the case I want to talk to you about is this guy. Now, he comes in after a transfer from an outside hospital. He got in a little scuffle and was diagnosed with a fourth metacarpal fracture. He was splinted and discharged. Now, the issue is that he's still in pain. He is not feeling well. And we're going to go ahead and re-x-ray it, and we see this image right here. This bone is not reduced. It's not going to be in a position where it's going to help this guy. He's going to have a difficult time healing. He's probably going to develop arthritis later. Now, Jacob, what would you do in this situation? How would you help this guy?
Set the wrist, walk away.
All right, that's one technique. Ben Grayboys, what do you think?
We could use propofol or ketamine for sedation.
Okay, so that's definitely an option. Ben Smith at Ultrasound Jelly, what do you think?
Well, how about just doing a landmark wrist block?
Okay, that could work. Now with this one, we'll probably want to do the median and ulnar nerves. The only issue with doing it at the wrist is that, especially for the ulnar nerve, the deep and the superficial branches of that nerve, they break off at a variable distance from the ulnar styloid. Sometimes it's 5 centimeters, sometimes it's right at the ulnar styloid, sometimes it's up to 10 centimeters away from it. And if you do it at the wrist, sometimes you run the risk of getting anesthetic into the artery because you're so close. If you go more proximally on the patient, like you see in this clip here, you can see that at about the mid-forearm, maybe a little proximal to the mid-forearm, you'll see that the artery and the nerve actually separate. So it's much safer procedure if you do it at this place. So here's a quick excerpt from a 5 Minute Sono video I did on this exact topic about a year ago. Now before I start, I want to show you where the anatomy is. You have the artery here, the nerve here, and then there's this other structure that might a little bit look like a nerve up here. This is the tendon of the flexor carpi ulnaris and is not a nerve. So make sure you don't block this thing. You got to look for this structure right here. And there you're tracking it up until right there it splits. And at that point, it'd be safe to do the block there in that location. So not only are you going to completely numb up the ulnar nerve distribution in the hand by doing it there, you'll also be less likely to perform an inadvertent interarterial injection of lidocaine. So don't forget the median nerve. This is a long axis approach here. Here's the long axis of the needle. Here is the nerve right here. I'm going to fast forward. You can see that you get right underneath it. You just infiltrate fluid all the way around it. You can also do this in short axis. I actually prefer to do this in short axis, but long axis definitely looks cooler. Don't forget to do this one as well on a patient that has that particular injury. And if you don't know or you don't remember how to do it, just go to 5minutesono.com. And I actually did a video on the median nerve block as well. So just click on it and there you have the video.
I will also note that when you do these blocks, if you look at a picture of a homunculus, the hand is really well represented, but the forearm is not. And so at some point between the forearm and the hand, there's a transition point. And I find the wrist blocks, when you do them landmark approach, to be very painful for the patient. But when you go up the forearm, patients oftentimes won't even feel the needle at all. That's
a pro tip right there, ladies and gentlemen. So after performing both an ulnar nerve block and a median nerve block, we waited maybe 10 minutes and the patient was 100% pain-free. We easily reduced the fourth metacarpal fracture, splinted him, and DC'd him. No IV was needed, no procedural sedation, no extra help, just you, the ultrasound machine, and the patient. It's a beautiful thing. That's it for this week's 5 Minute Sono. If you have any questions or comments, feel free to email me or send me a tweet. And don't forget to subscribe. Go to blog.5minutesono.com/subscribe, put your name and your email address, and never miss another video. And if looking at websites isn't your thing, you can always subscribe. Go to iTunes or whatever other podcasting site you use, type in 5 Minute Sono, leave me a rating or a review, and subscribe. Oh, and if you don't believe me about this being a perfect reduction, check out this x-ray.
Oh my gosh. Oh my gosh.